We'll be having this webinar today really to talk about returning to activities in the community as a lot of the mandates are being lifted and things are changing, and we've gotten COVID-19 under some degree of manageability at this point in time. I'm Lisa Kleinbub, the Executive Director here of Regional Center of the East Bay, and I'll be presenting part of this today, and Steve Robinson, our Director of Community Services, will also be presenting on what's been going on in terms of thinking about returning, especially to day service activity. After the presentation, we'll have time for questions, both in the chat, and we can also unmute you if you want to ask a question. So I'm going to start with sharing my screen. Which always takes me a minute or two. Okay. Okay. That's just my introductory side. So I wanted to give everyone an update on COVID-19 and vaccines in our community. Every day we get reports of people who've tested positive for COVID-19. And I just wanted to share, in March, we had 17 reports during that month. In April, we had 5 reports of people served testing positive, and we had no reports so far in May of people testing positive. We continue to get a few reports of people who tested positive last year that we hadn't heard of before. And so that's about what we're seeing in terms of the spread of COVID-19 in our community right now. For vaccinations, we're seeing that demand is decreasing in our area. Many adults, it's over 45% in the East Bay area, have gotten at least one vaccine. And we are seeing expansion to 12 to 15-year-olds this week who are eligible for the Pfizer vaccine. Across the area, appointments are available, and even the appointments for the 12 to 15 age range, which is only eligible for one of the vaccines, are pretty available for anyone who needs them right now. And so we are seeing more people getting vaccinated, but at a slower pace. And if you are still concerned about where to get vaccinated, this PowerPoint will be on our website, but we have links for Alameda, Contra Costa County, and for the entire state of California website at My Turn. I think one of the things with vaccinations is we do expect that by the fall, there will also be vaccinations available for younger children, probably down to age 2. And until then, there still will be groups of people who are vulnerable to getting COVID-19 in our community. The other thing I'll share here is that we've all heard, I think in the media, the guidance from the CDC that vaccinated people may not have to wear masks indoors fairly soon. And from the governor, it sounds like as of June 15th, there may be a lifting of the mask mandate indoors for people who've been vaccinated. I think that's something that we're all going to have to adjust to and see what our comfort level is. And I think there are a lot of concerns that while we have a high rate of vaccination in the Bay Area, there are still people who are not vaccinated, and there are still some concerns about what that will mean for spread. So I think we'll all have to be patient and adjust to it. It's going to be hard to think about not wearing a mask in a lot of environments at this point. So I'm going to turn this over to Steve to talk about what's been going on, and I think Steve will probably want me to continue to move forward with the slides. Is that correct, Steve?
Yes, please. If
Okay.
you don't mind.
Okay, so you can start with this one on the last 6 months.
Okay. Good afternoon, everyone. So as many of you, or probably all of you know, during the last 6 months for day services, our day program providers have been implementing alternative service delivery because they have not been able to do in-person services. The supports really should have been based on individual needs during those hours. And you know, we look at pre-pandemic activities and what people were able to participate in. The alternative services, of course, are different, but they are meant to provide services that continue for individuals through the pandemic, although most of those services are occurring over Zoom. If there were any in-person services, for example, some of our early start providers, some of our therapists were able to visit in person, always following guidance for social distancing is required. So that's basically what's been happening over the last 6 months. And what we're transitioning to now is day services are looking at resuming in-person services. So, you know, there have been many considerations for reopening. To be honest, you know, a lot of fear about reopening, not only for providers who are anxious to reopen, of course, but also clients, family members, some of our residential providers, questions, what does reopening look like? Can this really be done safely? So the considerations really are based on COVID cases declining, more people getting vaccinated. Programs are looking at outdoor activities being prioritized. Of course, looking at how to safely serve people, really looking at the CDC and local public health guidelines and following the stricter of the two guidelines. Transportation is a big one. How are we transporting people to and from day services? You know, what types of social distancing can be practiced so that everyone is safe? Of course, looking at person-centered plans and what's important to and what is important for each individual. And obviously important to look at what services will look like going forward. You know, when we talk about resuming in-person services, a lot of programs are going to start off as a hybrid. So it may be someone coming back 2 to 3 days a week, and the other days continuing with alternative services. So transportation, what we've done to prepare, what we've done to help our providers prepare, we've asked for a safety plan from our transportation contracted vendors prior to starting in-person services. We've communicated with paratransit systems of day programs that are going to start providing transportation to and from the day services. We're asking transportation to submit a safety plan to us that includes CDC guidelines for rideshare services. We are working with day programs, and when we learn of working with our transportation providers, what the schedule will look like, we're communicating potential delays to the day services. For example, CDC public health guidelines, people still have to be 6 feet apart on, let's say, the van, and they have to be 6 feet from the driver. So unless really they live in the same residential home, this could be a group home or family home, they can be together, but they still need to be 6 feet apart from others. The challenge is, so you may have a van that pre-pandemic would transport 5 people at once, and now with the 6 feet social distancing requirement, you know, maybe they could transport 2 people at a time. So what does this do? This doesn't allow transportation to all happen. Let's say the program starts at 9. The transportation vendor may need to drop off 2 people, come back, pick up two other people, drive there. So it is complicated to figure out. but that is what we're working on with our transportation providers and our day programs. Yeah, also we're requesting, we do have a lot of day programs who have transportation as an additional component. So the same requirements exist for those day programs to submit a safety plan and to follow the CDC local public health guidelines. And I think I've already talked about this, just requesting a schedule from day programs with contracted transportation vendor route to confirm estimated times on arrival due to social distancing requirements. So for day programs, for licensed site-based day programs, of course, they are expected to follow local, county, and CDC guidance. If they are licensed, they need to check in with community care licensing prior to opening. Community care licensing has been somewhat vague about that, but I always say to the err on the side of caution. We are asking our licensed day programs to check in with them to inform them that they are resuming in-person services. Both Alameda and Contra Costa County Public Health are not requiring that adult day programs check in with them prior to resuming in-person services. We are requesting safety plans from our day program service providers prior to resuming in-person services. It is important to note, because this has come up a lot, I know for service providers, for clients, for family members, a lot of concern about having everyone vaccinated if they return to program. Community care licensing did put out a provider information notice that programs cannot actually say no to serving someone in person if that person has not been vaccinated. So I know there's been a lot of requests from individuals, from family members to say, I only want my loved one, or I only want the person living in my home going back to program if they're going to be with other people who are vaccinated. Unfortunately, our service providers cannot share vaccination status because that would be a HIPAA violation. And also community care licensing is saying that you're not allowed to disqualify someone from resuming in-person services if they have not been vaccinated. I mentioned hybrid schedules before. Day programs are offering staggered days to reduce number of individuals at the program at once and on one day. And this, again, is to follow safety guidelines. There will be, on the days that people don't go to day program, alternative services, such as Zoom classes being offered. So community-based programs are not under community care licensing. So they're a little different. They're really planning more for outdoor activities. You know, we think of fresh air balanced with small, consistent groups as a safe way of providing these services. And of course, they are expected to follow local, county, and CDC guidelines. Again, the stricter of the two.
So I can take over this part, Steve. In April, DDS, Department of Developmental Services, issued a directive that regional centers have to start visiting individuals who lived in licensed settings, family home agency services, independent living services, and supported living services. And these are all settings in which pre-pandemic quarterly visits were required to monitor the IPP and make sure people were doing well in those settings. And so the directive was issued on April 21st. And so this means starting May 21st, we are to have a plan for starting these visits. And our quality assurance staff and case managers will be the ones conducting these visits. We plan to limit the time for visits indoors to 15 minutes, and will follow public health guidance. So a lot of the visit may take place going outdoors in the backyard of a home or someone's home, and maybe doing some pre-visit information gathering via a remote method, telephone or Zoom. I anticipate we will do this 15-minute limit for at least for the first quarter, and then we will all be a little bit more comfortable with things going on in person and be able to adjust depending on what we're seeing in the community. Right now, we will have to do those visits to those types of settings. However, for people living in family homes with their family, based on DDS directives, people can request that a remote visits for meetings can continue. And if there's a meeting that has to be longer in any setting, we can also do some form of remote visit to make sure we can complete the work in a way that's functional. We will definitely be having case managers wearing face coverings at least for the first quarter, and hopefully, in my opinion, a little longer, but anyway. I wanted to talk about the people who are, we are going to continue to support people living in out-of-home settings in many ways as programs reopen, but in a hybrid model. We know that people will need supports beyond just the hours of in-person day program, and we will continue to provide whatever additional supports people need, either in a licensed home, supported living, in the family homes when people aren't able to attend programs and families are working and need additional support for their family member who is at home. We're also looking at school reopenings, and we anticipate that most school districts will open full-time in the fall. That is the expectation, and it probably will be almost all school districts. But we do also understand that right now there are children on hybrid schedules for school. And there will definitely be children who have not returned to school at all during the summer. And we will continue to support childcare and other supports through the summer for those circumstances. We will then re-meet with the ID team starting in the fall as to what the needs are as we move into the fall period. Because there may still be families who have children who are pretty fragile and haven't been able to be vaccinated because of their age, we will continue to discuss what kind of supports people need if children aren't able to return to school yet and parents are starting to need to go back to work if they were working remotely. So we're going to manage all of those things. The other thing is that the regional center is going to slowly begin to reopen for things in our offices. We will start with reopening for in-person assessments by our clinical staff, because while we've been able to do a lot of things remotely, there are some assessments that we haven't been able to do for eligibility, and we were able to make people presumptively eligible for services when the pandemic started. And we've done a lot of that so that we wouldn't stop people from being able to access services initially when the pandemic started. But we also do want to get some assessments done at this point. And we will look at how long we continue to do presumptive eligibility, depending on the needs of individuals. So that is all we have in terms of PowerPoint slides to share with you. But I'd like to stop sharing now and open it up to questions. You can either ask a question in the chat, or you can raise your hand and we will be able to answer your question. There's first question is this going to change if you start in-person activities? And that comes from Tanya. And I will try to allow Tanya to speak so that maybe I can understand your question a little bit more, Tanya.
Hi, yes, this is Tania Delgado from the ICC Community Integrated Collaborative. My question is regarding families on your regional center, especially Latino families. Um, they're being requesting additional hours for COVID. I have families that have requested these hours over a month or 2 months, and they haven't had no authorization nor denial. So I want to know if this is because you're not having reunions in person.
So, Tanya, thanks for that question. We've been having meetings with families since the pandemic started and offering supports, including additional childcare, especially when children are learning from home and also parents are engaging in work. So if there's any family member who hasn't been contacted about that, please, you can reach out to me, or you can reach out through our website through Write to Us, and we will make sure that someone is followed up with. We've put a lot of supports in place during the pandemic at this regional center, and so we will certainly follow up on that with whoever it is. Thank you. Okay, let's see what else. Is there anything else, Tanya?
Yes, I'm asking more about the POS. How often do you get the meetings, the committee, or to have like more services?
So if anyone is interested and needs additional support, they should reach out to their case manager, because based on a family request, we can always hold an IPP meeting to address new needs and new needs for services. So there's nothing about time. We do see and talk to every family once a year.
And
this
is there
year
an
we've done
average
more
time
than
that you can resolve this problems?
We should be engaging with the family within 15 days if they've made a request from us for a meeting. So please have anyone who has a concern reach out, and through our Write to Us would be excellent way to do that. Thanks. Okay, let's see. Amy asked about a day program opening on Mondays. Other programs have no plans. Is there a directive for when programs need to start? Steve, do you want to talk about what we're doing with programs?
Sure. As I mentioned, we're reviewing safety plans. There is a day services group that meets every Friday with regional center present as well. We received a lot. A few are opening in May, others are opening in June. I have not received it from every program. The question is there a directive that they have to open up? There is not such directive right now. We are keeping a list for those who submit safety plans, and we're going to take a look at that, and we're most likely going to be reaching out to the other day programs where we haven't received those safety plans to ask what their plan is for resuming in-person services. But to answer the question about any firm directive about that they have to reopen, there is no such directive right now from DDS.
But if someone wants to return to program and they're not hearing from their program, please reach out to your case manager, because we expect most programs should be really trying to engage again in in-person services to some degree. And there's certainly always the option of looking at what else is out there if you need a program that's open in person sooner rather than later. Let's see. When is your deadline for programs to submit a reopening plan? Like Steve said, we don't have a deadline, but when anyone doesn't have a program and wants to find out more, please reach out to your case manager, because there should be engagement. Julia asked, the hybrid 15-minute in person doesn't feel like enough time for our meetings. That's not going to be for families. That is actually going to only be in the place where people have to be monitored in their licensed homes. And so that is a requirement that we actually see the person and see where they're living and make sure everything is okay. But with families, we will certainly spend more time, and that can be done by Zoom, and we will certainly be working with you on when we can do more in-person visits. We have had requests now from families to do things outdoors, and we're certainly going to be working on making that possible for people, because that's what, I mean, I can tell you that we are all anxious to do more in that. And then we have a question, what do you think is the timeframes that providers will be able to open in person? How long do we think it'll be? Do we have any idea, Steve, of how long?
Some providers have already started providing in-person services. Something that we requested to arrange transportation is that providers notice us 5 weeks prior to opening, especially if we need to arrange for transportation to and from. So again, it's a fluid process right now. We have received a lot of reopening plans. As I stated, a few have started already. It looks like a bunch more plan to start up again in June. We have not received safety plans for resuming in-person services from everyone at this point. But so far it's been kind of a staggered process. And again, we have no firm date of when we could say to a day program, you must open up by this time.
Thank you. So there is a question about how frequently IPPs are done. IPPs are generally completed once every 3 years. However, they can be completed more frequently based on need, and we often do addendums to the IPP if there's only one area of a service needing updating. There's a question here, Steve. Quarterly visits, this has not been happening at all. That's true. We have not been doing physical quarterly visits. We have been doing visits remotely to homes, and our quality assurance teams have been doing video and remote visits, as has community care licensing in licensed homes. And then Steve, someone would like you to expand on activities in outdoor settings other than parks all day. Realizing day programs are left to do activities without oversight. Do you want to talk about that?
Sure. The activities should be meaningful, so it shouldn't just be going to hang out in a park. I don't know the specifics of which program you're talking about, but they should be varied activities, not just going to hang out in the park.
So the next question is how to get a copy of my son's IPP. I mentioned this to someone else, but if there's something where you don't feel like you're getting a response from the case manager or the manager, please use our Write to Us function that we have, and we will make sure that you get a response through that mechanism. And case managers do change from time to time. However, you should be getting a notice when you have a new case manager. And we also do have a directory on the website, and you can call our operators who will answer and tell you who your case manager is. There's a concern about people who haven't been able to benefit from Zoom-based programming. So we have actually, that is one thing that we definitely want people to look at, who should be returning to program first, because they haven't been able to benefit from Zoom programming. So Steve, do you want to say anything else about that?
for folks who can't participate virtually. Yeah, unfortunately, due to the pandemic, I mean, alternative services are somewhat limited, but I do know some programs have done things like dropped off supplies, talked on the phone. Yeah, it's been challenging.
Yeah. And Amy, you said your son's program hasn't communicated anything. Please leave a private message there and we will do some follow-up on that. Programs, especially if they were doing alternative services, should be engaged with people. And so we want to know about that. So let's see. There's a question, why do we ask for consumers' physician contact information when we're not providing services in those areas? Well, that's interesting because many of our services are funded through federal dollars through something called the Medicaid waiver. And one of the requirements is that we look at all areas of someone's life, and that does include looking at whether people are getting health care, and if that's an area in which we would need to assist them in that area, we're certainly happy to do that. So that's why we have to ask that. It's sort of one of those requirements for many of our funding sources. So that's something we're looking at. There's a question about dates for orientation for self-determination. Self-determination is a new program that's been undergoing a pilot for the last 3 years, although I would say that we really haven't started with that until we got a lot of guidance, which was a year and a half ago. But today, the governor's budget revised came out at the state level. And we expect that that includes some information on what self-determination will look like moving forward in July. And so as soon as we have enough updated information to start orientations, sharing that information, we will let you know, and we will post those on our website. And if you're interested in self-determination, please look at our website, and we do have some informational videos there. So, let's see. Majority of our consumers say they want one-to-one care when they come back to the day program. If that's a service provider, it sounds like that is, please reach out to Steve specifically rather than that is a question, because it's all based on individual needs. Let's see. Are we as consumers legally required to provide the physician's contact information? So if you are the consumer served by the regional center, you are not obliged to participate in a review of your healthcare status. You can say no. We will document that, but you are allowed to say no to that information. And then we will follow up with Amy on her question about that program. We appreciate hearing that. Will day programs be required to offer the same form of transportation that was provided before COVID? Steve, do you want to talk about transportation? It's complicated.
It is complicated, but if they are, if the day program is vendored for transportation, then yeah, they should offer the same form of transportation, but with safety precautions. It's going to probably mean staggered times for people arriving and leaving. So
yeah. Okay, and so Michi did post something about self-determination in the comments, and we really do want to talk to any programs that you're telling us about who haven't submitted a plan, because we really do want to encourage them to start reopening to folks. And if we need to, we will reach out to each of those programs individually. So I think some of the people who are have their hands raised, I'm going to start and unmute Raina if you'd like to ask a question. Okay. Raina, I'll come back to you. I have someone whose name is Greetings for our lead something. Would you like to speak?
Hello?
Hello?
Oh, can you hear me? I don't know you was talking to me.
Yeah.
I have a question. My son doesn't fit in the programs because he get anxious and start hitting himself when it's a lot of people or more people that he used to. So the program doesn't fit for him. Do you have other programs that he can be benefit for him?
Steve, do you want to talk about that?
Well, I think you should have a conversation with the case manager to look at all options. And the case manager is certainly welcome to reach out to me or community services to look at what those might be.
And I think we'd also like to find out what it is that we might be able to do in other ways to help with anxiety. We've been recently working with some new programs, including some kinds of specialized services that can support people who have psychiatric concerns as mental health concerns as well. So we'd be really interested in trying to help you with that and help your child as well.
Thank you.
Thank you. I have a BM, and I'll unmute that person as well. If you'd like to ask a question, I know you had one in chat.
Hi, can you hear me?
Yes.
Hi, you mentioned, oh, thank you so much for having this community update meeting. I really appreciate it. So you mentioned in a prior question that the self-determination program will be released in July. Has that been pushed back? I think the original release date was rollout was supposed to be June. So has that been being pushed back?
Well, that's a good question because the pilot was supposed to end on June 7th. And it's from all the information we've been getting from the state, it sounds like there's a little bit of debate over whether it will open for everyone on June 7th or 8th or July 1st. So I've been saying July 1st because that's the last day I would expect it would reopen, just so people don't get their hopes up and then find out that it's not starting yet. But we're optimistic that today the governors may revise, included additional funding to get people into the program and really successfully help them launch. And so I think we will get you information on that as soon as possible. I'm hoping that maybe what we can do, because I know it's an area of a lot of interest, we can hold our June community meeting at this time and focus on self-determination, because it will seem like that's the right time. So thanks for that question.
Can I ask another question?
Sure.
The Tri-Counties Regional Center was part of a all-in self-determination seminar that RCEB actually was allowing its consumers to participate recently. And in that seminar, the Tri-Counties Regional Center offered to allow other regional center consumers to participate in their orientations that they are holding right now in anticipation of the rollout in June. So my question is, will RCEB allow its consumers to participate in the Tri-Counties Regional Center orientation and accept that as their orientation?
Yeah. I guess what I'm going to say about that is, because those orientations provide a pretty general overview of self-determination. We will look at that for people who've participated through another regional center. There may be, because we do expect there to be some changes in the program when it moves to everyone, there may need to be some sessions or things that you need to kind of revisit if they're different. So, you know, that's what I would say. We're certainly open to you thinking about doing another regional centers orientation.
So would you accept it as that's the required orientation?
Yeah, I think we will, but there may be differences with the new program. So you may have to learn some other things as well. Yeah.
Okay, thank you.
Yeah. The other question here is for day programs with multiple sites, are they required to submit a reopening plan for each individual site?
Yes.
Steve is saying yes. Yeah. Yeah. And is there anyone else who has a question? I don't see, I think I unmuted everyone who had their hand raised. The only person I see with their hand raised is Greetings, but I think I already unmuted you when you spoke. And let's see. And Raina, is Raina still there? All right. Well, for everyone, please keep up with our website and please sign up for our email updates. And I'd also really encourage you to use Write to Us if there's anything you need assistance with. We are really hoping that we all get back to being able to do things in person a little more by the fall, and look forward to meeting some people on this webinar in person at some point in the future. However, I do think that we will continue to do webinars via Zoom because it's helped a lot of people get questions answered that weren't able to get those. And let me, we'll put the, Michi, can you put the Write to Us information in the chat again? There's been that question. And Susie is asking who moderates or checks the Write to Us email address. That is checked in my office, and those messages get forwarded to my attention so I can make sure that they're followed up. But we'll stay open for a few more minutes to make sure. There's one other question. We are opening the day program based on consumer feedback. Yes, and all of our providers should be reaching out to individuals to actually speak about the reopening and what each individual wants. We do expect that some people won't be wanting to reattend day program for a little while longer. Michi?
And I think part of the question is, when do you need to submit your plan to RCEB? Again, if we need to provide or set up transportation services, we ask for it 5 weeks prior to you opening. We did send out a form to our providers to fill out. If you don't have that form, please email me directly.
I'm so sorry. One last question.
Sure. Yeah.
It sounds like you've been, or RCEB has been hosting monthly meetings to date since some time. Okay. So for some reason, I got dropped off for a while, for, I don't know, like 4 months or something. And then I received the most current notice. It's nice to have these email notifications, so I know, oh, I gotta sign up, you know, and put it on my calendar. But for some reason, for the last 4 months, I did not receive any email notifications. At least 4 months. We're in May, so yeah, the last 4 months. So I was wondering, you know, do I need to re-sign up for these email updates again, or?
Please do that just so we don't lose you.
Okay.
Yeah.
And that would be through the, and I'm so sorry, if you can remind me, what page on the RCEB website would that be?
You can just email us your information and write to us, and we will get you on the list.
Okay, thank you.
Thanks. Okay, well, thank you very much. And yes, we do post our meetings on our Facebook page as well. And that's another way. If you go to our website and you scroll all the way down, you can do that. Yeah. Okay, thank you. Thank you, everyone. And we'll see you again next month. And you can also use Write to Us to tell us what topics you'd like to hear about in the future. Bye-bye. Thanks.